Picking the right doula for you. It looks like a lot of you guys are looking for information on this, so I am here to tell you after 20 years of seeing labor and delivery doulas, because that's right, there are different kinds of doulas. There's postpartum doulas, there's death doulas. Also was a hospice nurse. Maybe I should become a doula. I can tell you guys how to find the right doula for you. In case we haven't met yet, hello, I'm Hillary. I'm the pregnancy nurse. I have been a nurse since 1997. I have 20 years of labor and delivery experience, and I have a lot of thoughts and opinions on doulas, as you can imagine, after 20 years of experience. And because you're thinking doulas, I bet you're also thinking more about the hospital. Grab my hospital packing list. I'll put the description below. Okay, the first thing you need to know is that most insurances don't cover doulas. Now, if you're on here because your insurance does cover a doula, I want to give you a big fat high five and say, awesome, let's keep talking about it. However, I think a lot of people are caught off guard by how expensive a really good doula is. And by the way, I'm here to say that expense will totally be worth it if you have the money. Hillary, when she was having babies, did not have the money. It was never something that we could afford. We were young, we were having our babies. Doulas just weren't in the picture for me. So if a doula just seems out of your price range, I 100% want to make sure that you're getting prepared for birth in a birth class. In fact, I don't think that a doula even takes the place of a birth class, although some of them will come to your house and do private birth classes with you, which I think is great. Come join me in the online prenatal class for couples, which I can tell you is cheaper than a doula unless your insurance covers it. But if they cover a doula, I bet they also cover birth classes. So check into that as well. Okay, the most important part of a doula is to check into their experience because anyone can call themselves a doula. In fact, my husband, who is not very helpful at birth, could call himself a doula because there is no regulation on who can or cannot call themselves a doula. Now, there are certified doulas, and personally, I don't think that that means anything because the certifications of a doula do mean that you can't do other things. So let's say they do some MA work in a doctor's office, they actually can't call themselves a doula, but that doesn't mean that they can't be really helpful at birth. So I just want you guys to be aware of that. Certifications may not always matter. In fact, I've seen a lot of certified doulas absolutely not helpful during birth. So don't let a certification make you think they are or are not the doula for you. Now, with experience, it's better if they've experienced hundreds of births. Most doulas will intern with another doula or maybe a midwife so that they've seen lots of different births. Now, it's not just lots of different births, it's lots of different births however you're going to birth. Now, if they've done a ton of home births and you plan to deliver at the hospital, that may not be the doula for you because the other bad news is a lot of doulas really only want to support birth in the way that they think people should birth versus how you think you want to give birth. So that's something to be aware of as well. And in fact, when I look at doulas a lot online, most of them had their babies at home and really only encourage home births. So that is not somebody that you want if you are having a hospital birth, because a lot of what a doula can do in the hospital is help you to ask questions, help support you in the way that they do at the hospital, which is very different than how you support somebody at a home birth. Some of you may be wanting an epidural or even an elective induction, and there are doulas who support that. I think any doula should be able and willing to support any type of birth. You get an epidural, they're there for it. You get induced, they're there for it. You deliver on hands and knees in the tub, they're there for it. They should deliver however you want. They are there for you. They are not there to impose their birth beliefs on you. By the way, that is exactly true of nurses, and nurses get used to this very quickly because we have lots of different patients from lots of different backgrounds, lots of different income levels, where we are just supporting them where they are at. Okay, the next thing is to be sure and get a contract. Some doulas are like, oh, I don't do contracts. It seems too businessy, but most likely this is an expensive transaction either for you or for your insurance. And it is important that you get a contract for the doula. It should say how long they should be coming to help you, any other perks like prenatal visits or postpartum visits, which by the way, I think a postpartum visit with a doula would be amazing. There are actually postpartum doulas who will come to your house and take care of your baby after they are born. So they'll come overnight, help you breastfeed or whatever you need. Oh my gosh, guys, that is the gift that I want to give people when I have $1 million. Which, by the way, when we can grow this YouTube channel, maybe I will have $1 million and I can give everyone a postpartum doula. When you like this video, it really helps YouTube know that my content is good and that they should be pushing it out to other expectant families. Okay, the final thing to know about doulas is they are there for support. They are not there for anything medical. They cannot check your cervix. They are there to help you communicate with your providers, but they are not there to give you medical advice. So let's say your provider comes in the room, kind of a drastic situation, and says, hey, you've been in labor a long time. I think we should do a C-section. Your doula then should say, okay, what kind of questions do you want to ask your provider about a C-section? And you can have a discussion with them about what types of questions you can come up with, because I totally understand that when something serious like that happens, your brain might go blank. So a doula can be really helpful in having that discussion with your provider. What a doula should not do is say, I don't think you should have a C-section, because that is medical advice and they are not there for medical advice. They are there to support you. Now, if you make the choice to not have the C-section, your doula should be there to position change, help you manage any pain, help you think of discussion questions as labor is progressing in case a C-section becomes necessary. And if you make the choice that a C-section is right for you, that doula should be willing to come in the room. They should be there for you postpartum. They should not be arguing with you that you haven't made the right choice. That is not their call. And if you see doulas online on social media giving medical advice, you already know that they are practicing outside their boundaries. That is not something that a doula should be doing. So now you know. All right. Are you planning for a doula? I have a whole video about the support that you can request during labor. Make sure that you aren't missing it. And are you planning on a doula? Tell me down in the comments if you're planning on a doula. And I think it would be fun to know kind of what the average cost of a doula is in your area, just so people can have an idea of what to expect at their delivery.